Today we're at the SMI conference on social media in the pharmaceutical industry, and we're here in London, UK. My presentation was about the sorry state of mHealth applications produced by pharmaceutical companies and what to do about it. I mean, for a number of years I've been talking about pharma and social media. Now I'm getting more interested in what pharma is doing on mobile. And in the presentation, I reviewed a lot of the applications that I've seen pharma develop that either are not very functional or that have bugs or that have other problems. So I tried to focus on what are the lessons that could be learned from that. And I also talked about how to improve what pharma is doing with mobile apps. Well, I've been following the pharmaceutical industry, what they've been doing in online and digital media for a number of years, maybe, I don't know, I don't want to say how long, but all those years, 20 years maybe, 15 years, they still spend a very small portion of their promotional budget on digital. And I know that in the United States, they spend a lot of money, for example, on TV. So we're thinking that's so old-fashioned. Why isn't pharma spending more on digital? So there are a number of reasons for that. But, you know, it differs from company to company. So some are doing a lot more on digital and others not so much. No, I really love coming to Europe because I think what some pharma companies are doing in Europe are actually much more advanced in terms of digital media, much more advanced than what they're doing in the US. And the reason I'm thinking that's true is because in the US, pharma marketers might spend 2/3 of their budget on TV direct-to-consumer advertising, which is not possible to do in Europe. So in Europe, the pharmaceutical companies have been more innovative in ways in which they relate to patients and consumers. And so I think, for example, their use of social media, they're not really trying to do branded communications on social media, but they tend to do other things that are more useful for patients. And I'm always surprised to learn what they're doing here in Europe. Well, my award is called the PharmaGuys Social Media Pioneer Award. I've been doing this for 5 years, and this year the 5th annual award went to Beringer Ingelheim's social media team, which included Jacqueline Fontaine and Patricia Alves. And Jacqueline was here yesterday, and I was finally able to actually physically give her the symbol of that award, which is an Hawaiian shirt, and she was very gracious in accepting that. Next time, though, I'm going to expand this award to not just cover what companies are doing in social media, but what they're doing in mobile and in patient engagement. So to me, social media is getting a little bit old. I've looked at a lot of what pharma companies are doing on social media. I don't know if there's any more pioneers there, but there's going to be more pioneers in other areas like mobile, so I'm going to try to look at that.
Okay. Who you pay? Are you a spy? What you do to get all this clever information on your website?
Well, I look at the news like everybody else does. I have news feeds from different sources, and I look at other blogs and what other people are writing about, and interviewing people and getting ideas from them. And when I see a story that I might have an interesting point of view about, then I might blog about it. I just don't try to blog every piece of news that comes by. Only stuff that I think relates to pharmaceutical marketing and what I consider to be issues that pharmaceutical marketers should be thinking about. And that's why people like to read my blog, because I'm able to say some things that really they haven't heard anyplace else. So makes it a little bit unique.
That's true. Thank you very much, John, for your content, and thank you for this interview.
Thank you, Pharma Geek. I appreciate it.